Hi, my name's Kirsten Eagles. My student number is T00698082. Today I'm going to be going over the sense organs, so the eye and the ear. So we'll start with the ear. So I have my list of terms here that I'll be going over, and I have my diagram here from my textbook. So we're going to start with the pinna. So the pinna is the outside part here, or the ears. They're that funnel-like structure that funnels sound down into the ear. You have the external auditory canal. So the canal is an L shape, so you have the vertical, and then you have the horizontal part of the canal there. We have the tympanic membrane. So the tympanic membrane is the eardrum, and that is that little section right in there. You can also see it here on this diagram. And we have the cochlea. So the cochlea is this kind of swirled structure here and here. We have the semicircular canals. So those are those little structures there that branch off. We have the auditory ossicles, so there's three of them. There is the malleus, the incus, and the stapes, or hammer, anvil, and stirrups. So you would have the malleus here, to be that structure there. Then you have the incus, which is that part there. And then you have the stapes, which is the part here that connects to the cochlea. Then we have the vestibular cochlear nerve. So it's not actually on this diagram, but it would be branching off this way from the cochlea. And that's what sends the nerve impulse to the brain. Then you have the eustachian tube. So the eustachian tube would be this little structure right here. Okay, so next I'm going to talk about oral hematomas. So oral hematomas are collections of blood underneath the skin of the pinna. So blood collects in between the skin and the cartilage of the ear. So it happens when if there's like irritation within the ear, the animal shaking its head can cause blood vessels to burst and cause that collection of blood underneath the ear. It's not usually painful or dangerous in any way, but it can certainly cause like deformation of the ear if it's not dealt with properly. So sometimes they have to come in and have them drained in order to correct that. Alright, so next I'm going to go over the structures of the eye. So I have my list of terms here for the eye, and I have my diagram here. Alright, so first we're going to start with the cornea. So the cornea is the structure at the front of the eyeball here. Then we have the pupil. So the pupil is that space right in here, and around it is the iris. So you have the iris on either side there. We have the ciliary body. So those are those little finger-like projections here and down here. Then we have the suspensory ligament. So those are those little ligaments that connect to the ciliary body and the lens. Then we have the lens itself. So that is right here. Then we have the choroid. So the choroid is in between the sclera and the retina, right along in here. Then we have the retina. So the retina is the internal layer that goes around the inside of the eyeball. We have the optic nerve, so that is right here. Then we have the optic disc. So the optic disc is where all of the nerves from the retina all meet. So they all meet right here, and that leads to the optic nerve. Then we have the sclera. So the sclera is the white of the eyeball, so that goes along the whole outside part here. Then we have the tapetum. So the tapetum is the very reflective surface along the back of the eyeball here. So that's what you see when you see pictures or shine lights at animals and they have those glowing eyes. That would be the reflection from that. You have the vitreous humor. So the vitreous humor is the gel-like fluid that's inside the eyeball. And then you have the aqueous humor. So the aqueous humor would be the thinner fluid on the outside or past the iris in here. Then around the eye, so I'll flip to just another picture here. So around the eye we have the conjunctiva. So we have the bulbar and the palpebral. So the conjunctiva is a very thin, translucent membrane. So the bulbar actually covers the eyeball itself, but you can see through it through to like the sclera and the iris and the pupil. And then the palpebral would be the lining that covers the actual eyelids. So it would be kind of down in here. We have the medial and lateral canthus. So those are where the eyelids actually meet. So you would have the medial canthus here and then the lateral canthus here. So then we have the nictitating membrane. So the nictitating membrane is the third eyelid. So it can be seen a little bit right in here. And then we have the location of the nasolacrimal duct. So it actually would start here with like where the tear duct is and go and travel down through to the nose. Okay, so next I'm going to be talking about the muscles of the eye and how they work for vision. So I have a diagram here that just shows some of the internal muscles of the eye. And then I have another one here as well that just shows like the ciliary bodies and the iris. So when we're talking about near and far vision, what muscles are used are the ciliary bodies and the suspensory ligaments. So for near vision, what will happen is the ciliary bodies will contract. So what that does is it loosens the suspensory ligaments, and that allows the lens to relax almost. So it becomes more round. And that helps with near vision. And then for far vision, the ciliary bodies will relax, and that suspensory ligament will tighten back up, and it'll actually pull on the lens and flatten it. And that's how you see for far vision. So then we'll talk about the amount of light coming into the eye. So the amount of light coming into the eye is controlled by the iris. So the iris has two groups of smooth muscle bundles. So you have the radial arranged fibers, and then you have the circular arranged fibers. So the radial arranged fibers spread out radially, and they'll actually dilate the pupil. So they'll allow more light into the eye. And then the circular arranged fibers will constrict the pupil to allow less light coming in. So that all depends on. Okay, so next we're going to be talking about pain. So the process of experiencing pain is called nociception. So nociception actually has 4 parts to it. So there's transduction, transmission, modulation, and then perception. So transduction is when the pain stimulus is changed into a nerve impulse, and that's picked up by the sensory receptors. Then you have transmission. So transmission is when that nerve impulse is sent through the nerves to the spinal cord. In the spinal cord, you have modulation. So modulation can actually be the changing of that nerve impulse. It changes what the brain can perceive. So this can happen with chronic and severe pain, and we're actually able to have an influence on that modulation process with various drugs. And then you have perception. So perception is when the brain receives all of that information and perceives the pain. So conscious perception of pain can actually affect different areas. So like the fight or flight response, or it can cause emotional reaction to the pain. So when it comes to visible reactions to pain, it can really vary greatly amongst species. There are some species who become very stressed to even just mild pain, while there's other species who won't show any visible pain until that pain is severe. So by being aware of this and kind of knowing what signs to look for, we're able to tell when an animal is experiencing pain and how we can intervene. As well, it can help us to be a little more proactive in pain management for these animals, and to overall increase their comfort level.